What's up, guys? Movement Project. If you're anything like me, you've had low back pain multiple times in your life. In this video, I'm going to go over general exercises for low back discomfort, stiffness, and pain. If you have anything specific going on, make sure you reach out to your movement specialist for a proper diagnosis and treatment. When we're going through this type of general exercise program, we want to start off by working through range of motion. Now, the spine works in multiple planes. We're going to start off doing this classic press up exercise, working on spinal extension. Don't go into any pain. I want you to do 10 reps, 3-second holds each to start. If it's too much for you, then you can just simply prop up to your elbows, hold that for 3 seconds, progressing to the point where you can hold it longer, 5 to 10 seconds. Some patients find that they get more relief when they hold longer, so by all means, go ahead and progress up to a 10-second hold. Now, you should never feel any pain when you're doing this exercise. It should just be a stretching sensation. It goes away as soon as you stop. You want to make sure when you do this exercise that you keep your hips down on the table, the floor, or the bed. We're going to work on flexion of the spine and the hip by doing a knee to chest exercise. You want to reach under the knee so that you're not forcing the knee into too much bend and causing any irritation. Go ahead and hold it for 3 seconds and work your way up to between 5 and 10 seconds on each leg, 3 times. Now, the position of your other leg is going to make a difference. If you have this other leg bent, it's going to be more low back stretch because you can see my hip is coming off the table, causing more back stretching. To keep it down, it's more just hip stretching. You should only feel stretching in the backside of your hip or your lower back. You should not feel any pressure or discomfort in the front of your hip when you do this exercise. The next thing you can do is bring this knee to the opposite shoulder, holding it for 3 seconds, building up to between 5 and 10 seconds. This is going to stretch some different muscles of the low back, hip, and pelvis. Now, if you want to grab the top of the knee on this one, that's fine because you're not putting as much pressure through the knee joint. Next up, we're going to work the spine laterally. So it's basically working on side bending of the spine. You're going to prop to this forearm position, and then you're just going to let your spine sag from that position. You can try to take a breath, 3 to 5 seconds. Come back to the start position until you're ready to go again. Repeat that 3 to 5 times. You'll feel some tension and stretching in your ribs when you do that. That's a-okay, as long as it's not causing any pain. Now, you should never have any pain or discomfort in your shoulder doing this exercise. If you do, just go ahead and skip it. Now, the next phase of the program is to work on rotation of the spine. You want to bring your knees and feet together, and you're just going to rotate one way, start off going to the left, and then you'll go to the right. Whichever way is easier, that's the way I want you to start with. So for me, it's to the left. I'm going to bring that down until I feel that barrier, and then from there, I'm just going to bounce about 5 repetitions just to give a little bit of a stimulation to the nerves and muscles at end range there. Go through 5 reps, bring it back up. We're going to go through 3 cycles on each. 5, go back to the right again. I'm not feeling any pain when I do this. If you do, make sure you back off and work at that new end range where there's no pain. Go through my 3rd set, 5 reps of the oscillating here. Should be very comfortable when you do this. 4, 5, and we're good. The next thing we want to do is work on our pelvic tilting. That's where we're trying to see if we can move our pelvis separate from our trunk and our legs. So we're just looking to see if you can mainly use your abdominals here and your lower back to lift your butt off the table and flatten your back, and then arch the back and flatten the butt. Each should be about a 3-second hold, and you want to make your way through 10 reps. Should be no pain whatsoever when you go through this movement. It should just be a smooth transition from arch to flat in the low back. You can feel my abdominals doing all the work. Legs are nice and relaxed. The next thing we want to work on is bridging. Let's start with our knees and feet about shoulder width apart. About a 90-degree bend in the knee if we can. And then our feet are in a position where the toes are up and the heels are down. Squeeze the butt muscles and see if you can raise up until your knee is a straight line into your low back. I'm raising until I feel some tension in my low back but no pain. Anything I feel goes away as soon as I go back to that start position. I'm holding 3 seconds, trying to make my way through about 10 reps. As you get better, you can certainly try to increase your hold time, 5 and even 10 seconds. The bridge exercise is a great way to get some muscle activity in the hamstrings, glutes, and back. That combination that we talk about as the posterior chain. It's so important for back pain. When those muscles aren't working properly, it's going to be really difficult to recover. We're looking at doing some gentle control exercises just to wake up the back, glutes, and hamstring muscles. We're going to lie on our stomach with our forehead on our hands and just try to lift that leg off of the floor, or if you're on the bed, for about 3 seconds. Now I'm going to do 5 in a row on the same leg before I switch, just so we can get a little bit of fatigue build up in the muscle. Should be no pain whatsoever with this exercise. If you do feel pain, you can place a pillow underneath your hips. Oftentimes that'll take away some of the pain for the patients. Now we never want to see you propped up when you do this exercise. There's far too much compression force in the low back when you do it in that position. Making my way through 5 repetitions without any pain. You want to try to tighten your lower abdominals, kind of squeeze in that belly button region to brace the front of your spine on this exercise. Now we're ready to move on to the quadruped or hands and knee leg extension exercise. This is going to work on some strengthening and stability together. I'm trying to keep my back as straight as possible, like I'm balancing a dish back there. And from my head to my hip should be a pretty straight line. From there, I'm just going to try to extend straight back, hold that for 3 seconds, and bring it back to the start position. Should not feel any pain, but certainly feel a nice pull in the low back that goes away when I stop. Again, if you feel any tension or discomfort that does not go away when you bring that leg back down to the start position, you should skip that exercise until you have the time to build up the strength for it. Hopefully you found this video helpful. If you want to see what exercises not to do for low back pain, click over here. If you want to help me cut out unnecessary surgeries, subscribe to the channel by clicking here. If you want to live, perform, and feel your best, you've got to move your best. Keep it moving.